Welcome to today's episode, where we'll be discussing a critical and often misunderstood topic, eating disorders in teenagers and adults. Joining us is Pearlene Lim, a senior clinical psychologist who specializes in psychotherapy for individuals facing mental health challenges, including stress, anger, and relationships. With her extensive experience working with adolescents and adults, Pearlene will help us understand the complexities of eating disorders and how we can better support those affected. So the reason why I was so interested in eating disorders is because recently there's this rise of Ozempic, and I've become inundated with requests from even adults and teenagers who are not skinny who wanted Ozempic from my clinic. Do you see a lot of eating disorders in your clinic?
I think we do see a lot of eating disorders in the clinic. I mean, over the past decade, there's been actually increasingly more cases. But that's also because there's been an increase in awareness. Like, people are aware that these are mental health issues, and then they come into clinic earlier as well for intervention.
So what are the most common age group for eating disorders to arise?
Actually, there's no such thing as a common age group. They can occur at any age.
Oh, really?
Yeah, I mean, it could be as young as, like one of my cases, the earliest onset was about 6 years old.
Oh my God, 6 years old, they have an awareness of...
No, they don't have an awareness, but it was when it started. So it can start very young, and then I also have people who, when they develop their eating disorders in their teens or during their adulthood, I mean, it can really affect anybody at any time. Yeah, so there's no particular age group per se.
So you're saying that there are some people with no eating disorders in their childhood, but maybe in their 20s or 30s develop one? So it can be an adult onset
thing. It is
thing.
possible. Yeah.
I see. Is there any reason why this could be so? Is it like a desire to control their life or desire for aesthetics, to look skinny?
I mean, to be honest, it could be both of those or something else. Because the thing about eating disorders in general is that it's a multifaceted kind of illness. Many possibilities as to what could have contributed to the onset of the illness.
I see.
I mean, it could have been, let's say, for example, if you are involved in like a career or activities that really emphasize, your weight and your shape. Let's say, for example, if you're in gymnastics or you're a ballet dancer or you're in athletics, these things do emphasize such things as well. Or it could just be as simple as a case of maybe you are going through some personal life stresses or personal difficulties in your life, and then maybe somebody passes a comment about your looks.
I see.
And then it could spur you on to want to diet, and then it could spiral out of control from that. Or it could just be like, if let's say maybe other things in your life, it feels like things are not very well controlled at the moment, everything is very stressful, everything is very overwhelming, you kind of, like what you said, you kind of want to gain back some control in your life.
I see.
That could also be the start of it. Hypothetically, let's say if you have very low self-esteem, then maybe you are also wanting to fit in with the crowd, you're not very well liked, then you might be more susceptible to the media's message of the teen ideal. You could be influenced by that to start dieting, and then let's say you like what you see, and maybe it just goes out of control. After a while, you lose that control over your lifestyle and everything. It could also develop into an eating disorder. I mean, there are many different things.
It sounds like the eating disorder is actually wanting to get control of their lives, right?
Part of it.
Yeah, part of it is. So does social media actually make it more common for people to have eating disorders because they can view all these skinny images of ideal women online? Yeah.
Yes and no, I think. I mean, in my experience, of course, there are societies that do promote the teen ideal. I mean, that's a very pervasive message in our social media today as well. You do see a lot of that. But then again, if you think about it, right? So many people are living in the same society, so many people are subjected to the same messages, but not everybody develops an eating disorder.
Yes.
So I think at the end of the day, as much as the media messages come, it can significantly influence a person, but it may not as well.
Right.
Yeah.
So what is the difference between somebody who succumbs to a message from social media and one that perhaps does not succumb? Is it a mental resilience thing or better support?
Definitely. I think both of that and more. I think what really matters a lot is, let's say, emotional resilience, like you mentioned. Probably your own priorities, your attitude, your support system. I mean, all of these go into play as well. So let's say if someone does not have high self-esteem, you know, or they are very not confident, and they basically worry a lot about things, or, you know, they don't, like I said, maybe they don't fit in with the crowd. You know, they end up worrying a lot about their appearance. They think about how to best fit in. They just be maybe more susceptible to like, oh, this is what is popular, or this is what is what is going to make me likable. And then it could, you know, develop into
so it could be
like
succumbing to peer pressure, and
it could be
images or messages on the news media, right? So in that case, these are common risk factors. Are there other common risk factors, like, I don't know, you know, people always blame their parents, so I'm just thinking overbearing parents or skinny mother. I mean, is there any risk factors that we could identify?
There are actually a lot of things that could contribute to an eating disorder, you know, and if there is a history of mental health illnesses that runs within the family, it could be that the child could be more susceptible to developing an eating disorder as well. Or if, let's say, other childhood experiences, let's say you've been through childhood trauma, you've been through a lot of bullying, you know, it could be things like that that also make them develop an eating disorder. You know, sometimes it's even as simple as like a comment, let's say within the family. I mean, this one is very common within,
like a judgmental family or negative family environment, right?
Or even by peers, you know. I mean, I have a lot of younger patients who come in and they say things like, you know, maybe when I was young, I was a little bit on the chubby side. During Chinese New Year, they always pass comment and they say like, you know, I'm 小胖, that kind of thing. Stuff like that, you know, or like they'll say like, you know, you need to lose weight, you need to, you know, you're too fat, you need to do this, you need to do that.
Relatives say that may be innocent, but you
innocent at the time, but the person remembers it. You know, and if they do internalize that message to be like, yes, you know, this is a bad thing. I need to do something about it. Then maybe they will actually start.
So like you rightly said, it's actually a lot to do with self-worth, right? Because somebody makes a comment, but if you have poor self-worth, it's going to affect you more.
I would think so. I would think so. I mean, it would definitely go into the whole idea of like having a very unhealthy perception of your body image. You know, and also, I guess self-worth also comes in maybe the aspect of like, if you are involved in certain activities and you fail at it, you're not really good at it, right? And then you find that, wow, you know, maybe in my life, so many things I cannot control. You know, like, or like I'm always a failure at so many things. Then what happens is that, you know, maybe weight is the one aspect that I can control because nobody else can you know, force me to eat or things like that. So it becomes an element that they may look to help with that.
That makes sense, though. You cannot control anything, but you can control your weight, right?
I mean, but to be fair, I mean, other things as well. Like I said, you know, if a person is going through a stressful life event and then maybe they turn to food for comfort, it could start off with emotional eating. You know, when we're stressed, we eat certain types of food, we crave for it more. And maybe from there, a person could overeat and gradually develop binge eating. You know, it could perhaps even move towards developing binges or even becoming binge eating disorder or things like that as well.
So is it more common in women than men, or is it, you think it's equal?
It is, one of the most common myths is that it's a female disorder.
I thought it was a female disorder.
But to be fair, I mean, it is predominantly female, but males can get it too, even though the percentages are much lower. I think statistically, probably about 10 to 25% are males, but predominantly females. But definitely men can get it too.
Men can get it too. So, you know, I think it's actually very good you're here, because some people have this idea that eating disorder must be anorexia, but actually there are many eating disorders, right? Could you just give us an idea of what, you know, you see commonly?
Actually, you're right. There are many different types of eating disorders, but I think anorexia is one of the more common ones that we see. You know, but we also see bulimia nervosa, where there's still the fear of weight gain, but for bulimia, it is usually more associated with recurrent episodes of binge eating, as well as inappropriate compensatory behaviors. Like you might see the person attempting to purge by vomiting or abusing laxatives or by excessive exercise, for example. But there's also binge eating disorder, which is also one of the things that we see quite common. So binge eating disorder is when there are binge eating episodes, but they don't have the inappropriate compensatory behaviors.
So they tend to be more overweight than skinny?
They can be. But not necessarily so. Because another myth, actually on that note, right? Another myth is that people, they say like, you know, if you look like you are normal weight, right? You cannot have an eating disorder. You look normal. How is it possible that you have an eating disorder? You know, some people think that you have to be either really, really small and skinny or like really big in order to have an eating disorder.
I see.
But that's absolutely not true.
Okay, I'm so glad you're telling us that. So being skinny doesn't mean you have, and neither is normal weight. So how do you diagnose it?
I mean, we do have clinical criteria,
Okay.
you know, and I think the clinical criteria is actually quite clear on that lah. But I would say the main features of an eating disorder, okay, let's say if I take anorexia and bulimia as examples, it really is the intense fear of weight gain and having a very unhealthy relationship with food. Because I think the main idea behind eating disorders in the first place, they are illnesses that manifest themselves in very unhealthy, disordered eating patterns.
Yes.
You know, and they usually have a very unhealthy relationship with food, a poor body image, body distortion, you know, body image distortion as we call it, you know, a high level of body dissatisfaction as well, you know, and that intense fear of weight gain, especially in the cases for the anorexics and the bulimics.
I see. No, because I was just, when you're talking, I was just thinking about my son who has a really strange relationship with food. He doesn't eat vegetables, but that's not an eating disorder per se, right? Because it only fits one criteria. You have to have the others, which is body dysmorphia.
Yeah, exactly. You need to have a number of criteria, including the intense fear of weight gain, you know, the poor body image, and I think more importantly, there must be functional impairment. You know, it has to affect you significantly in your daily life.
Right. Can you give me an example of like maybe some patients that are so significantly impaired by these eating disorders? Is it to the extent that maybe they lose so much weight they cannot work, or they go to extents to hide their disorder that
they cannot work? Yes, that does happen.
Really?
Yeah, it actually does happen quite often. In fact, when you just asked me this question, the first person that just came to mind was this old patient from before, where essentially I remember very clearly, this was a 19-year-old girl, very young. She had anorexia, and by the time that she came into the clinic, she was probably battling it for at least a good 6 to 7 years.
Oh, that's long.
But she was so skinny to the point that there was once she kind of tripped and fell down. She broke bones and she could not get up because there was absolutely no muscle.
That's crazy.
Yeah, you know. I mean, sometimes it's really that impairing to the point that you can't even walk, you lose your mobility.
Yeah.
And also cognitively, you can be a bit slower sometimes as well.
Yes, I can imagine, right?
know?
Not eating.
And I guess, you know, having the whole preoccupation with food all day long, you know, it's also not going to make it easy for you to concentrate well.
Yes.
People do lose their jobs, or they are unable to attend school. They drop out of school because of their condition. Yeah. You know, and also their social relationships are impacted. I mean, a lot of social activities revolve around food.
Yeah, and if you cannot eat.
Exactly.
I can
you know,
see that.
so if you can't go out there, you can't eat, you can't socialize, you know, you lose quality relationships as well.
For sure.
Yeah. So
but she actually took such a long time to be diagnosed. Could it be, is it because she wasn't aware of the condition herself, and so somebody had to kind of bring her into the clinic?
Back then, there was probably a higher stigma attached to mental health conditions in general. Like people would not be as forthcoming to come into the clinic to seek professional help unless it's like, wow, really, really very bad already, you know, I cannot do anything.
Really?
Yeah.
Do they have the insight to actually go and see you, or do they even recognize it's an eating disorder?
They would I think a lot of them do recognize that it is an eating disorder and that they do have an issue. It's just that they may try to recover on their own first. You know, and then maybe after a certain number of attempts or after a certain period of time, they realize that, hey, you know, it's really not working out lah.
I see.
You know, and they really need professional help because it's also impacting other areas of their lives quite significantly. But that being said, though, I must say, thankfully these days it's a lot better than it was before. You know, in terms of that stigma around mental health disorders. People are more open about mental health disorders these days, which is great. We do see people coming in for intervention much earlier. I have a parent who might bring the child in and they say like, you know what, 2 months ago she started doing this, you know. And at least it's like, okay, that's only 2 months, you know. There's something we can work with. We can still try to nip it in the bud before it actually gets really reinforced and really, really bad.
Yeah.
Whereas in the past, we might see some patients actually dealing with it for years and years and years, and then finally it's like, cannot already, we need to do something about it now. So that's one of the biggest difference.
That's true, mental health is, there's so much more awareness now. But what happens if the problem happens in an adult? Like, for example, if I had an eating disorder that I didn't know about, but I just put it as, I just want to be healthy. Everybody do this intermittent fasting, or they use Ozempic because they want to be a bit skinnier. They see a celebrity using it. At what point is it vanity, and at what point is it eating disorder?
When there is significant functional impairment.
Okay.
To be frank, there's nothing wrong with wanting to live a healthy lifestyle. I mean, it should be healthy. It should be well balanced in that sense, But I think that
you shouldn't be too obsessed about it that it impacts your daily life, right?
Once you realize that, hey, it's kind of, I think the word obsessed is a good one. Like if you notice that, hey, you really think about food all the time. You can't really concentrate on anything else. And you're always constantly thinking about your weight, your shape. You're very preoccupied with all that kind of thoughts. And you're very scared to eat. You find yourself indulging in like very secretive eating behaviors, or you find yourself like constantly thinking about, I want to lose weight, as opposed to like maybe I'm doing exercise to feel good or to feel healthy. If it gets to that point where it tips over to like, okay, wait, it's affecting your work performance, it's affecting your ability to be a mom, or to be a daughter, or to be a partner to your spouse, or things like that. That's when we know that, hey, we've kind of crossed that line.
I mean, this is not happening in Singapore, all these skinny jabs, all these Ozempic jabs. But do you have an opinion, like, with the rise of these quick fixes to being skinny, will this make eating disorders worse?
Potentially. I think, there is definitely a possibility that if such things are readily accessible to the masses, assuming that you can get it even without a doctor's intervention, right? Some people may abuse it.
Because you're already saying that some of your patients may be using laxatives. And then now this is another tool in their whole armamentarium to help them.
So especially if it's a quick thing.
Quick fix. So you don't think the idea that it's an injection is going to deter them, because people with eating disorders are quite motivated?
They can be quite motivated in their quest to lose weight, because sometimes the power of the eating disorder voice or the eating disorder thoughts in their heads can be really, really strong to push them to great lengths to just achieve, that zero number on the scale or whatever it is that they want.
That's true. So how does one treat eating disorder? I presume a lot of talking to them. I mean, because some of them they may not recognize that it's a problem. Say a child that's brought in by the mom,
I don't think we generally see too much of a problem in diagnosing a patient. Assuming that they are forthcoming with their symptoms and they don't downplay the symptoms, but we usually don't see too much of a problem with diagnosing. But I think the main challenge that we face is getting them to take that first step to actually challenge their eating disorder. Because it is scary for them to step out to do something different. I'll give you a quick example. Like let's say, for example, for a normal person like you and me, maybe if let's say I put you on the scale and you just gain 100 grams, what would you think about 100 grams?
Nothing.
Not much to you, right?
Not much to me.
But imagine if you had a very intense fear of weight gain, and it's so irrational that I can tell you, to my anorexic patients, that number on the scale, that 100 grams, they will freak out. Because it is so scary to them.
Right.
And if you think about, I'm just going to use the example of anorexics for a moment. If you think of recovery for an anorexic, the journey does involve weight gain. Because the fact about an eating disorder and why it is such a serious mental health condition is because it does affect a person physically as well. It can affect your physical health. Right. So we do need to make sure that we get your weight up to the point that is at healthy weight, that you are able to function well. Your body is actually okay. So it does involve weight gain, and that is extremely, extremely scary.
I can imagine, because it's so counterintuitive for them. They want to be skinny, but you're telling me that the treatment's going to make them not skinny.
And also because they have maybe a warped perception, or like a flawed perception of body size and body image. These are really, really skinny people objectively, but they see themselves in the mirror as huge fat whales. And that's what they see. And if you tell them that this huge fat whale has to add on more weight, it is scary.
I see.
You know, and I mean that brings about a lot of challenges in trying to get them motivated to work with us.
So how do you do it to overcome this challenge?
This is where a lot of psychotherapy does come in. I mean, we do work hand in hand with a lot of other allied health professionals as well as the psychiatrists, because the nature of an eating disorder, it affects a person in so many different ways. You know, it affects their physical health, it affects their ability to function, their ability to do things. You know, and we also need the dietitian in as well to make sure that they have a good meal plan that could work for them.
I see.
So it is a multidisciplinary approach that we usually take. But I guess in terms of the psychotherapy, where we deal with the dysfunctional thoughts, the dysfunctional beliefs, the attitudes that they have, and the motivation as well. I mean, gold standard treatment for eating disorders is cognitive behavioral therapy.
Okay.
Yeah, but that being said, I mean, from my own experience, I do a lot of CBT as well.
Okay.
But in my own experience, I would say that it's really important that the treatment is tailored to that specific individual.
Okay. Yeah.
I mean, everybody has their own story, and everybody is unique in that sense. So if I can tailor it to make sure that it is a place where, how should I put this? I think what's important is that the treatment that is tailored to them must be able to, you know, provide a safe place for them to explore all their fears, you know, without judgment.
Okay.
A place for them to be able to step out and slowly try different things, again without judgment, you know, with a safe place to explore their vulnerabilities.
Yes.
It's also a place to build up their self-esteem. It's a place to build up healthy eating patterns. I mean, we must provide that kind of environment for them. So with that in mind, I would say that sometimes in actual practice as well, I incorporate elements from different treatment approaches as well. It could be acceptance and commitment therapy, ACT, dialectical behavioral therapy, DBT, you know, or interpersonal therapy, IPT. I mean, it could be different elements for different things to best suit the person that I'm seeing.
Okay.
Yeah. Does that make sense?
Yeah, it does. I mean, I know a little bit about CBT, the cognitive behavioral therapy, but maybe you can elaborate for those people who don't really know very much, you know.
I mean, cognitive behavioral therapy, as the name suggests, it does include the cognitive portion, which is basically dealing with your dysfunctional thoughts and beliefs.
Okay.
And then, of course, the behavioral part, which is essentially trying to work on helping a person achieve more adaptable, healthy behaviors as part of therapy. So it is again multi-pronged. You know, you do work on how they perceive things, how they make sense of things. You know, unhelpful thinking patterns and things like that, all their fundamental core beliefs that they might have about themselves. You work on all those things so that they also can develop healthy coping strategies. You know, in terms of the behavioral stuff, like let's say, you know, I will be teaching them things like anxiety management, stress management, mindfulness techniques as well. So everything all together can come together as CBT.
I mean, I've heard of very good results from CBT, and I think it's good because you're actually treating the root cause, right? Because our thoughts are the root cause to a lot of behavioral issues, but we always think the same thing, then do the same thing. So now what you're trying to do is look at the thoughts and then interrupt this whole habitual reactions and provide a new perhaps a new reaction.
Basically,
them, right?
yes. Because if, let's say, the fundamental thoughts that they might actually be endorsing at that point in time are really, really flawed or really unhelpful, I mean, it's not going to help them feel better. You know, so we want to teach them how to develop different ways of thinking, you know, to reframe their perspectives a little bit, you know, to essentially shift their mindsets. You know, to have a better, healthier mindset, which would probably lift them up more, make them happier, you know, make them more goal-driven, so that they can actually move towards normalcy and regain normal functioning again.
I mean, interestingly, I think everybody should go for CBT. I think it can help a lot of people in normal life and optimize themselves.
It is gold standard for quite a number of treatments.
It is a gold standard. You mentioned a few others. I didn't get it. The interpersonal relationship therapy, is it?
Interpersonal therapy. I mean, that one is really looking at interpersonal relationships and how that affects the person.
I see.
Then there's also acceptance and commitment therapy, or ACT. I mean, that one there are elements of CBT in it as well, but it really looks at, I would say, kind of like seeing, you know, like this is what the person comes with, how we look towards accepting what is and trying to make a change about the things that we don't like, to align our values, to align our actions and behaviors and thoughts to be more in line with our values that we hold, so that we experience a fulfillment and meaning, for example.
Okay. Yeah. Okay. So do you think is there a difference in response between men and women to all these therapy? Would you say women respond better than men, or men are more, they don't think so much, so maybe?
Actually, it depends on how forthcoming and how psychologically minded they are, how ready and how open they are for therapy. I won't say there's any specific difference per se, but I think what we commonly see here in Singapore is that men are a little bit more, okay, I won't say all men. Men can be a little bit more reserved or like less forthcoming with emotions, you know. So their emotional vocabulary may not be as good as a female's.
Okay. Yeah. How about age? Would somebody younger be easier to treat than an adult female with eating disorder, you think? Or it makes no difference?
I don't think age is the primary factor that influences whether they are more treatable or not.
How long does a treatment like this take? I guess it's not a fixed time and it's not short.
Eating disorders are actually a very long-lasting disorder. You know, I think one of the common misconceptions again is that some people come in and they're like, oh, how fast can I recover? Like is this a chop faster?
Is there a pill to take?
You know, is there a quick fix? You know, like I see you for 5 times enough or not? I'm sorry, the answer to that is really no. You know, it is a very long-lasting disorder, and it can actually take years. You know, to recover. Of course, the earlier you come in, assuming that your onset, like I mentioned earlier, there was one that only came in with the onset of 2 months. That person recovered much faster than, let's say, if someone who has had the eating disorder for like 5 years and then now you're coming in. Yeah, because I think if you think about it, the longer you've had it and the longer you've actually reinforced those behavioral patterns, you know, and the disorder eating and the disorder, the bad body image and everything. I mean, if all those things are very, very, very strongly reinforced, it's going to take a lot more work to kind of undo all that as well.
I understand. So somebody with the eating disorder, is it likely to relapse, or is this something that they always have to work on?
Statistically, about 1/3 can relapse lah. Yeah, you know. But that being said, not all will. There's also 1/3 that recover very well, you know, and they are fine. I would say that it really depends on what they do to try to maintain their progress. You know, I mean, it is something that they'll probably have to work on for quite a period of time, just to make sure that they don't fall back into the eating disorder. But it does happen now.
You know, that's interesting because one of our last guests was a nutritionist, and we were talking about these young girls that had eating problems and their nutrition was pretty flawed. And she mentioned that sometimes when she sees the young girls, she finds that the problem is the mother, because when the mom comes in, the mom is just as skinny, and the mom also will not eat a lot of different things, because I think clearly what she's implying, that mom may have some sort of eating, may not be eating disorder, but certainly some disordered eating behaviors. So, I mean, do you commonly see that, like not so much run a family, but mother influencing a child?
I won't say common, but have seen. Definitely have seen. Because I think if you think about it logically as well, as a child, when you're born, right, you pretty much have no sense of normalcy other than, you know, the environment that you grow up in, and you learn certain things. You definitely model and shape after the adults in your life. You know, you will see what your parents are doing, you will see what your mom is doing, and so on and so forth.
So if your mom is always telling you that you're fat, then after a while you may believe it. So with people with eating disorders, the main thing is coming to see you. Isn't that nobody can actually overcome this by themselves, you think? Is this something that if they recognize it, is there something
again,
they can do at home to?
I would say it depends on how severe the condition is. You know, I mean, if it's still in its early stages and it's quite mild, there are some people who can probably recover on their own if they have the insight to recognize that, hey, it is potentially turning into a problem. You know, and then they do something about it to nip it in the bud. So those people, they probably have a chance at recovering on their own. But let's say if it's really deeply entrenched, you know, to the point that, again, very, very poor functionality, you know, or like you just can't do a lot of things. And maybe the parents or the family, because they are not well versed with eating disorders, they may not know what to do or how to help. And that is when I would definitely say, please seek professional help.
And are eating disorders associated with other sorts of mental behaviors like depression, anxiety, panic
commonly, very, very commonly. You know, I mean, it is Actually, those two that you mentioned, they're highly comorbid with those two.
Oh, really?
Yeah.
So usually do they come for eating disorders or depression first? Which one would they seek?
I think for people with eating disorders, most of the time they come in with eating. The problem, the key problem that they come in with would be the eating disorder, because it's probably the behavior that is most pertinent lah.
But would treating one impact the other?
You have to treat the person as a whole.
I see.
It is not. Okay. It is probably not possible to isolate. You know, I can't just say, okay, I treat your ED only, and I'm not going to bother by your anxiety. But here you are getting anxious over your meals. You know, or like you are getting anxious and worried about a lot of things.
Yeah.
Let's say, for example, if your mind is consumed about food and weight and shape the whole day, you know, you cannot concentrate on your work. You know, you're worried about your work performance, and you get really, really anxious and jittery. How would it be? How would I be a good clinician if I say, okay, wait, that part I'm not going to touch. Sorry, I don't deal with anxiety at all. No, I only want to deal with your eating disorder thoughts.
Yes.
I can't do that. You know, I mean, you have to address the person as a whole.
Yeah.
And to be fair, like things like depression, sometimes it is because they are so depressed that they don't have the motivation. They are unable to push themselves to even take that first step.
Yeah.
To even do something about their eating disorder.
Yes.
Then am I going to say again, sorry, your low mood, not my problem, okay? You go and deal with that. I only deal with this. I can't.
For sure.
Because everything affects the person, you know, it comes as a package. Yeah, so you have
what I'm more wondering is, like, sometimes if you give somebody antidepressants for depression, do you think maybe that will help the eating disorder? But as you said, you probably will, because they're both interconnected, right?
Yeah, the psychiatrists that we do work with do prescribe the medications as necessary, which can include antidepressants as well.
Okay.
And some of the antidepressants also can work to curb binge eating tendencies as well.
Oh, okay. Yeah, so then it makes a difference. Because, you know, a lot of people don't have awareness, and, you know, women and children, they can actually hide their disordered eating habits. Like, you know, you mentioned bulimia, which I think I once had a classmate with that, where she went to vomit after every meal. But she hid it so well, and none of us knew for years. And she wasn't super skinny, but I guess she was probably skinnier than what she would have, her normal weight would have been. But she hid it for so many years. And we only heard later that, you know, she had an eating disorder. So what are risk factors, and how do we spot them in the people around us?
Actually, it's really observing those kinds of behaviors, because I think if you are not the individual, there's no way you will know everything. You know, so it's really about keeping that keen eye out to see whether there are certain behaviors that you notice. Like, let's say, for example, if it's a friend, you know, maybe when it comes to meal times, like every time I'm asking you out for a meal, you're rejecting every single thing. You know, but if I'm meeting you for some other things, maybe you're willing to come. But then if it comes to a meal, you might be avoiding meals. You know, or like you engage in quite secretive behaviors. You find that the person is hiding away a lot to go and eat, don't want to eat with people, things like that. I mean, you just have to observe what is going on. And if you pick up on certain things that seem a bit abnormal to you, or like, hey, you know, I don't think normal people actually kind of do that. You know, then that would be probably a sign to talk to them as well. I mean, even in meal times, you know, if you find that they are kind of like always, maybe they always have tissue, they might put it in their mouth, they chew and they spit, you know. I mean, it could be things like that you notice. Or if you notice that, you know, they're very picky about food, or they're avoiding certain types of food consistently, or just refusing food. I mean, you could see all that kind of stuff.
I see.
Yeah, and if you happen to notice that it happens, you know, maybe there's a pattern of it happening a few times or several times, then, you know, you might want to speak to that person.
But you mentioned anorexia and bulimia and binge eating, but the treatment would be roughly the same, right? Which is, you know, looking at the root causes and doing a lot of psychotherapy and understanding it. So it really doesn't matter what the cause is, because it still comes from your thoughts and your beliefs.
A lot of it, yes. You know,
I see.
But I would say, as much as understanding the cause of it is important, it's also really, really important to look at the big picture, that, you know, this is already happening right now. You know, sometimes looking back isn't always helpful. It's really where we go from here, how we move forward. And try to improve things from where we are. So you also just be mindful not to get too caught up in.
So is that where the CBT comes in? Because that's forward-looking, helping them change their behavior.
I mean, everything lah. Everything lah.
I see. That's, you know, if a person has anorexia, are they more prone to get other issues, like maybe the anorexia is sorted and then one day they develop bulimia? Does that happen that way? Not really.
It can.
It can.
It can switch from one type of eating disorder to another as well. It's not impossible. But I would say for anorexia particularly, now it's actually one of the psychiatric illnesses with the highest mortality rate.
Oh, right.
Yeah.
Why do you think that's the case? Because it's so resistant to treatment?
No, because it affects them physically. Let's say if you're very severely malnutrition, your body's going to shut down too.
Yes.
You know, you're bound to have a lot of medical issues and things like that
I
may,
see.
you know, eventually result in death.
I see. What is the most common age group for anorexia in Singapore now?
It still ranges though.
Okay.
I can't say with absolute certainty like it's only between this age to this age, but okay, onset-wise, you probably see it more within the teenage years to maybe the early 20s.
Okay, so that's probably the age group that we have to watch out for the signs, right? Do you think this is rising in Singapore?
Over the years, we have seen a trend of it going up, yeah.
But you said that could be explained by greater awareness, perhaps.
But we also see more cases starting younger, and we also just see more cases happening. I mean, to be fair, given if I look at, say, even the social media kind of messages, I remember there was one time where there was this TikTok going around where basically you want to see whether you can fit around the waist like a paper thin waist and things like that.
Yes.
Or you want to see whether your collarbone can hold a certain amount of liquid or things
That's
like
crazy.
that. I mean, some people do subscribe to these things, you know, and
Yeah, my time that was the one was thigh gap.
Oh, yes, you also see
but
that.
people didn't realize it's actually all structural. You can be very skinny and have no thigh gap.
Yeah, exactly. But if you get the message that thigh gap equals skinny, and that's the only definition that you go by,
I see.
then you know you could be trying to achieve that.
So you mentioned your youngest was like a 6-year-old. Was that a pursuit of beauty? Did she even understand that?
Oh no.
Oh,
no,
it wasn't a pursuit of beauty.
Gymnastics.
Ah, okay. So a comment that
Her coach would comment on her size at that
I
point in
see.
time, and then it just kind of started from there.
Yeah.
And I mean, like I said earlier, it could really, the onset can come not just in childhood. I mean, again, adults can get it too. Like I can give you an example that just popped into my head. There was this person, of course, in the name of patient confidentiality, I can't say too much about it, but I can give you an example of one person. This patient was in a relationship with her partner at that time, but they broke up. Okay, but during the course of their relationship, he constantly gaslit her, would say things about her size, say she's ugly, and nobody will ever want you because you're the ugliest, fattest human being on earth, you know. And I mean, it was a very bad relationship for her. You know, it was also emotionally abusive for her as well.
Yeah.
But that kind of comment really, really got to her, you see.
Yeah,
and it really eroded her self-esteem.
Yes.
You know, to the point that she's like, you know, I have to prove a point. I need to lose all this weight. I need to.
Yeah.
And it spiraled out of control.
Yes.
And then,
Yeah. I mean, what you said is actually so important is when it spirals out of control. Because I'm sure all of us, before our wedding, after a holiday, after we gain 5 kg, we always have this need to, I think maybe we should cut back. But it's the people who let it spiral out of control that are the ones that probably will end up having an eating disorder, right? I mean, we may cut off food for, you know.
And which is again quite normal.
Quite normal.
If you think about normal societal expectations and things like that, or normal behaviours, I think those things do fall within that realm of normal behaviours.
Yeah.
But it is really when it crosses that line, you know, when it really like something that you try to control but then end up being uncontrollable, and then it goes so bad that it causes so much dysfunction and impairment in your daily life. That's when it becomes an issue.
I can see that. I mean, especially in those days where Kate Moss was touted as the ideal and she was so skinny. I think everybody thought that unless you had a body like that, I mean, even I thought that I was fat when I looked at her, but you know, that obviously didn't help. Yeah,
so involvement in, like I said, activities or careers that emphasize weight and shape, modeling, dancing, athletics, you know, or running even. I mean, some of these things, we do see that quite a number of cases from this kind of
because I think those sports do need people that are of a certain size though. You need to be on the skinny side, but it's just whether you let it spiral out of control, like how much. But there are some body types that will never reach that sort of physique. Even if I wanted to be a model, I don't think I can ever look like Kate Moss.
I mean, genetically you have your own set point, and genetically, you know, based on your own structural build and whatnot, you know, you're built a certain way.
So I guess, you know, maybe that's where your acceptance, there was ACT, that helps, because if I can never be like Kate Moss, then I should accept that I can never be like Kate Moss.
Which is also why, as part of therapy, one of the biggest things that we do is really to provide that safe place for a person to build their self-esteem, their self-worth, and even self-love.
Yeah.
You know, they need to be able to see their own positive qualities for what they are, and that they are also, in fact, you know, human beings worthy of so many things. You know, they deserve so many great things as well.
Yeah.
But we do that in that space that they feel safe to explore that.
I mean, I love it that you talk about self-love. I think that's actually one of the most important things, especially for women. Nowadays, we are so inundated with all these images of what is perfection. It's very difficult to love ourselves, you know. Sometimes just looking at our own photo, we don't really like what we see. Maybe we should start loving ourselves first.
I'll say be kind to yourself, you know. I mean, we are our own harshest critics.
I think
you
so.
know, and I think that's true for most of us anyway. You know, but it may be a bit more of a conscious effort to be compassionate to ourselves and to really kind of like be kind to yourself, you know, tell yourself that, I mean, okay, let's say even in the case of, okay, let's say I've had an eating disorder, I've recovered, and then maybe, oops, I had a setback or like a relapse of some sort, you know. I think it's really important, even in those kind of circumstances, that you are kind to yourself to say that. I mean, if you think about it, normally if you walk, sometimes you also slip and fall, right?
Yes. It's okay to fail, it's okay to relapse. Don't think of it as,
Exactly, you know, I mean, don't let one brief relapse become a full-blown relapse.
Well, I think that's actually quite profound, I think that's very good,
Yeah, so it's kind of like you want to make sure that you're always kind to yourself, to allow yourself that space to say, hey, you know, this did happen, you know, but okay, if next time there's a similar situation or like something happens again, you know, what am I going to do about it instead? You know, don't beat yourself up over it.
I think it's very important to ground, because, you know, your story that, you know, the relationship and somebody you love is calling you fat. Nowadays, it's not just that. I think on social media, sometimes you post a photo, and if it's a public account, you'll be amazed. You can have a lot of people saying you look nice, but then there will be a few saying you're so fat, and there'll be negative comments. And some people really pick it up. Like some of my teenage patients, they will tell me, you know, so they get very affected by
which
that.
is why building up your own sense of self-esteem, as well as your emotional resilience, your own coping strategies, etc., is so important. You need to have that little toolbox of skills to manage all this stuff.
It's true. You cannot stop what people want to say, but you can control your own reactions.
100%. 100%. You always have a choice as to what you want to do.
That's true. If there's anything you want to say to women out there that are very concerned about their self-image, what is a few tips or tricks you can give them to perhaps, you know, cultivate some self-love, you think?
One only,
to improve their
one only very hard. I mean,
okay, say 2 or 3.
Okay, we were talking about comparisons, right? So
Yeah.
I think that's still one of the bigger ones there. You know, it's not the easiest thing to do, but it is important to recognize that your journey is your journey. It's really me versus me. You know, I want to improve from a previous version of myself versus I need to be like somebody else or like things like that. You know, and again, look at yourself to remind yourself that no one is perfect. You know, we all come with strengths and weaknesses. It's not strengths or weaknesses. You know, so you know, be kind to yourself, accept yourself for who you are. You know, and probably be able to just understand that, you know, it's okay to be not so good at certain things as well, lah.
Okay.
And maybe try to fill your life with, I mean, clarify your values, you know, and try to fill your life with activities that you do personally find meaningful as well. Because sometimes the more rewarding it gets in those areas of your life, then the less likely you are to focus on like things like weight and shape. Because if you think about it on a daily basis, it's not like we walk around with our numbers, our weight around, you know. I mean, like I look at you, I don't even know how much you weigh. You know, and that's not important for me to know. You know, and likewise, you don't know what I weigh, and that's not important for you to know either.
Exactly.
You know, it's not something that needs to play a big part in our daily life in that sense. You know, so if you can find something else that's a bit more meaningful and fulfilling, you know, you probably be more likely to veer away from that.
And not need so much external validation, because then your self-worth will come from your own
of course.
rewards. Thank you so much, Pearlene.
You're welcome.
Thank you for joining us today, and special thanks to Pearlene Lim for her invaluable insights on eating disorders. It's clear that early intervention and the right support can make a world of difference for those struggling with these issues. If you found today's discussion helpful, be sure to subscribe and stay tuned for more episodes on mental health and wellness.